issue of infertility in the young, we have a problem with lifestyle factors. Now, smoking has become a norm. There's nothing that destroys the egg and sperm as cigarettes,
grass, ganja,
anything.
Shisha.
I had a surrogate mother that asked her, do you smoke tobacco? She said no, but she smoked weed. Alcohol. If you're drinking 3 bottles in a sitting, please reduce it to 1 bottle in a month if you're trying to conceive. After conception, you can go back. Processed food, shawarma has become a normal thing. Meat pie, donuts, anybody that is hungry now, do the math. Check anyone, say, I'm very thirsty. Check what they buy.
Carbonated drink.
Exactly. Nobody buys water.
Doctor, I want you to say that because when I talk to people and we're talking about IVF, and most times maybe surrogacy or whatever, and they always talk about CS, they say that people usually wonder why must it be CS? And they feel that, already there was this misconception about CS on its own, and now added to the misconception about IVF. So now combining the two, I've had somebody say things like 2 unnatural things.
That's wrong. CS is a mode of delivery.
Okay.
There are indications for cesarean section, just like there are indications for vaginal delivery. There are indications to do IVF. I tell people IVF is not 100%. If you get it at the first trial, it's a miracle.
Yeah, that's true.
Yes, because only 50%, at the best percentage is 50%. Worldwide, you can go and check your statistics. 50. But in our center, we do, say sometimes we have 75%, even 85% success rate. You understand? But worldwide is 50-50. We do IVF for a 50-year-old. 50-year-olds are giving birth in our center. If I know there are people in social media, the job is to comment. Commenters club. They say CS is that. Listen to me carefully. I said, if you follow through your complete antenatal, your PCV is fine, everything is good. CS is like any other surgical procedure.
I then know the assisted reproductive technology for men. Is it that when our own don't go, you don't go?
No, the beauty in men is that men, the motility begins to decline at a later age when they are 50-something. A man can produce sperm all his life.
A young lady, maybe in her early 20s, and I'm like, see, I have like a 10-year, 15, 20-year career plan in front of me. I feel that having a child, or as the case may be, may distract what I want to do. What kind of advice do you have for such a person?
What I would advise the person is to, first, she has to.
Welcome to another episode of the Intimate Matters podcast. And on this podcast, we take you on a deep dive into the world of sexual and reproductive health. And for today, we want to talk about something that affects most people. If it doesn't affect you directly, you know someone it affects. It could be your friend, it could be your family member, it could be your colleague at work. And today we want to talk about infertility. We want to bring a perspective to it, being the perspective of assisted reproductive technology, being a way out to help people, families and individuals who may be infertile. And today we have an amazing guest in the studio, Dr. Chinoye Eze. Thank you for joining us, ma'am.
Thank you so much for having me.
All right. So for people who don't know, a doctor has been almost around in medicine. She's been around general medicine. She's been endoscopic surgery, and now she's in the fertility space. Ma, just a bit about yourself. So what prompted your journey? What was the thing that motivated your journey to just, go through these spaces? I know people start somewhere and just stay there.
Yeah, for me, from the very beginning, I wanted to be a doctor.
Okay.
I wanted to be a surgeon specifically. So I remember my first JAMB, I got the cutoff, but there are some family issues. I left it. I wrote again. I didn't get it. And I wrote the third one.
3 times.
And I got, So I got the admission. I studied for a while in Nigeria. Then I traveled out to finish my degree in medicine. Then I did a specialization in general surgery. Then I super specialized in endoscopic surgery. And coming back, I think I worked in a fertility center and I saw it became an eye-opener. So I went back to do a specialization in artificial reproductive technology and IVF. Okay, so
you talked about coming to work in a fertility center and seeing a couple of things. Can you share some of those things? I know you cannot share, or some cases or a scenario or an incident that was like, something needs to be done, and I think I need to play my part in doing something about the fertility issue?
I met a 42-year-old, my first case, a 42-year-old woman who she is a lawyer. So she put her career in the forefront. So when she was ready to conceive, she's not able to use her eggs.
Okay.
So after doing the test, we told her she's not able to use her eggs. And she broke down. She was like, she didn't know. So imagine a lawyer in that caliber, not aware that as you grow older, there's a decline in your egg quality. And there's a certain age you won't be able to use your egg. So you see that gap in knowledge. You expect someone who is a lawyer to be aware, but it's not usually like that. So that brought me, and I saw several women who has literally lost hope. So someone told them, and hearing that there's a procedure they can do to conceive, it's like a how will English people call it?
It's like a ray of hope.
A ray of hope. So seeing that, I love minimally invasive surgery. And most of the procedure in IVF is minimally invasive. We literally don't open. From hysteroscopy to retrieval to transfer, it's minimally invasive. So it's inside what I studied. So I just loved it and I continued in that path.
Okay, all right, because we know that the early part of next month is the Fertility Awareness Week or month. June is already a Fertility Awareness Month. Yeah, so there will be a whole lot of advocacy across the country, across different spaces. But what we've noticed is that with all this advocacy, with all this push, that most people still do not have this knowledge, like you said, because it's expected that maybe as you grow with your literacy level, you're supposed to know some things, but you go on social media, maybe you're going around the community and the things people say, you know that most people do not know about this. And then sometimes we look at the effect of culture and maybe the effect of religion and the effect of tradition. So in your practice, how does culture, religion, and maybe the socialization play into how it affects how people utilize this care?
Religion and culture has proven to be, one of the barriers we need to overcome. You will see a lady come, you do assessment, and then you place her on some drugs to take. She goes back and says her prophet says that if she takes the drug, she will not conceive. That is a spiritual problem.
Wow.
Now, this lady, her AMH is low. No, let's paint. See, I love God. I am I'm a born-again Christian, but I am one of the believers that feel that the knowledge God gives a doctor is to help. We are partnering with God. In our center, we always say we partner in God to bring about what he has said. Now, seeing this lady, she has all the indications that her ovarian reserve is low. She's advanced in age, you understand? And this procedure, and you see a prophet says, this is one. There's one, you see a very big fibroid, and you know that you need to remove it. And then you see a prophet says that if you do the surgery, you will die. You see, these are barriers. So I used to say, even when I used to go to the radio, I said, please, the religious leader, help us help these people.
Okay.
When you see a case that you know is not, some of them, you know that this woman needs help. So she spends so much time doing prayers, doing a lot of things, and at the end it doesn't work. And then she comes back to you when she needs to do IVF with a donor egg, and she becomes, so I cannot use my egg. What can you do, doctor? Doctor, please help me. If you don't do it, I will die. And she had some time to do the right thing. That's a barrier. The second barrier, I've spoken about religious. Now, culturally, please do not shame any woman who needs assisted reproductive technology. Now, the word assisted means we are assisting. We are not the one giving the baby. There are barriers we need to overcome to achieve pregnancy. That is what that's what we do in IVF.
Okay.
A woman gets pregnant when a sperm moves through the vagina to the cervix, passes through the fallopian tube to the ovaries, fertilizes it, and comes back. Now, there are barriers to that. If both tubes are blocked, The sperm cannot pass in and the eggs cannot come out. If there's a big fibroid in the womb, it's a barrier. You understand?
Yeah, surely.
If the cervical mucus is too thick, it's a barrier. If the sperm count is too low, these are barriers. So we overcome that barrier. That is all we do. Retrieve the eggs, take the sperm, prepare the sperm, mix it with the egg, and put it back into the woman. That's where our work stops. Okay. And then we now provide the woman with the progesterone, which the body usually produces on its own. But because we are doing assisting, we have to provide that progesterone. And then we give the person progesterone supplement to take for 2 weeks. The same thing the body will do. We are not manufacturing children.
Okay, I love that part. You are not manufacturing.
We are not manufacturing children. It's an assisted reproductive. It's a technology that assists women to conceive. It's very simple. It's not complicated.
All right, thank you so much, Doctor, because it's important that the viewers out there and the people who will be seeing this should know that when it comes to assisted reproductive technology, the medical people are not manufacturing anything. It's just the same natural process, but assisting to ensure that if there were barriers, they can help to see how they can overcome that barrier. Because if you look at what you see like on social media, the way people, that's why I feel that some people cannot even give testimony of having, maybe if they had a baby through IVF, they don't give testimony in church.
Let me give you a very funny scenario. I always share this testimony. I went to a church. Okay. I won't call the name of the denomination.
There you go.
So the woman gave birth to 3 boys. So we went for dedication. The woman stands in the pulpit and said, I thank God because we waited for so long. And God did it. This is my doctor. She can testify that it is through the natural process. I was there. I cringed. I didn't move. I was just there. I was just smiling.
She wanted you to come and join her and lie.
I said I was just smiling. Now, I tell people IVF is not 100%. If you get it at the first trial, it's a miracle.
Yeah, that's true.
Yes. Because only 50%, at the best percentage is 50% worldwide. You can go and check your statistics. 50. But in our center, we do, sometimes we have 75%, even 85% success rate. You understand? But worldwide is 50-50. You understand? So if at the first trial you get it, you're the one of the lucky ones. So God has a hand in it. But don't put me on the spot where you and I know. It's IVF with the donor egg that gave you those children. And you put it. So pastors, religious leaders, as much as you want, to grow audience, please let the people tell you the truth. You understand? Do not make some people, there and there, there's a woman that was trying, she said, if God can do it, this is one I heard. It's not someone told me, if God can do it for this woman, I will keep on praying. There and there, where we're sitting. So you see now, this woman that was supposed to come for help, but because she has heard a fake testimony, now she's not coming for help. It's very important. Doing IVF and succeeding is a miracle on its own. Do I say, or should I say God does miracle? I've seen cases whereby they get spontaneously pregnant even after a failed cycle.
Okay. Because
we've stimulated the ovary. I tell people, even if it fails, we've stimulated that. Those ovaries are stimulated. Keep calculating your cycle, and some people get spontaneously pregnant the next month. It happens. That's a miracle. But when you do IVF and you get pregnant, tell the next person, because you don't know if the next person needs that services. You understand? So these are the scenario we are passing through. It's becoming a problem. Everybody is shying away because they feel if you do IVF, God's hand is not in it. No. If you do IVF and it succeeds, God's hand is in it. Because I've known people who have done 5 treatments in reputable hospitals, coming to our clinic to do and getting pregnant. It's not that those 5 clinics did anything bad. They are reputable. There are hospitals who started IVF in Nigeria, and it failed. Okay. But coming here, it's a miracle. You understand? These are the things that I just need sort to share light. You understand? So people should know that.
All right. So if you went through the process of IVF and you had a child, it's a miracle. Share your testimony, but share the testimony the right way. Tell the truth that it was through IVF so that you can help the next person, because you see this on social media, and sometimes, and this also goes out to the people out there, because one of the reasons people lie is because they don't want to be shamed.
Exactly. Yeah.
Because they don't want to be shamed, because they feel that if I say it's IVF, I've heard this one where they say that a baby that was conceived through IVF is not, how do they put it? They say it's not a normal baby.
Yes, I've had a patient ask me, she got pregnant. She was like, "Doctor, can I breastfeed my baby?" First, I didn't understand. I was like, "How?" My nurse was there with me. "How?" She said, "No, can I?" I said, "Ma, it's." I had to explain to her what IVF is. I said, "You can breastfeed your baby. We don't take deliveries in our center. We get you pregnant, we refer you back to the doctor that sent you. So you can do the scan anywhere. You can say to go to Lagos to do the scan. We're having people even come from the US, UK. You can do it there. Take your antenatal there. Take your delivery there." The only thing we advise people to do is when you get pregnant, do a CS, because most of them are multiple. Because you know how much you spent. You know the emotional stress, the time. So do elective CS so those babies can be taken peacefully, and then not the one you say you're pushing, you did not push where this one happened, all those complications. So we try to avoid it.
Okay.
But if you have single thing and you have a good hospital and monitoring well, of course you can deliver vaginally. There's no contraindication.
All right, doctor, I want you to say that, because when I talk to people and we're talking about IVF, and most times maybe surrogacy or whatever, and they always talk about CS, they say that people usually wonder, why must it be CS? And they feel that, already there was this misconception about CS on its own, and now added to the misconception about IVF. So now combining the two, I've had somebody say things like two unnatural things.
That's wrong. CS is a mode of delivery.
Okay.
There are indications for cesarean section, just like there are indications for vaginal delivery. There are indications to do IVF. There's indications to do IVF. You can do conventional. You can do with ICSI, intracytoplasmic sperm insemination. When the sperm is very bad, there are indications for this. There are reasons why you do it. The indication for multiple pregnancy, whether through IVF or naturally, is CS. Because you cannot predict the life of the baby if you're having twin or triplets. Even those multiple pregnancies is already high risk. But in Africa, you only have multiple pregnancies. It's a miracle. It's a testimony. But abroad, they'll tell you, one of the risk factors for ARTS is multiple pregnancy. For them, it's a risk factor. It's high risk. But for Africa here,
it's a testimony.
It's a testimony.
People are going around drinking water, looking for multiple.
It's a testimony. You understand? So multiple pregnancy on its own is high risk. You understand? So CS is an indication for it. CS is just like any surgical procedure. It has risk, minimal. If you have an experience and a good obstetrician, there's usually no complaint. If you follow your antenatal, your blood, if you follow what you need to do, there's usually no complaint, but it's high risk. You understand? So the reason why most people advocate, even if when you have a surrogate mother, to do CS, is that it's safest. It's not unnatural. It's an indication. It's safest because you know how much those people spend to get those babies are precious baby. So it's easy to open up, remove the baby, close up, and everybody's happy. Than to go through the 3 stages of labor.
Which complication can
happen at any stage. And then, so how can you explain to a commissioning parent that the surrogate mother was in 3rd stage of labor and the baby died? Mm-hmm. Do you know how much is surrogacy outside? How can you explain, after paying millions of naira, how can you do that explanation? No, let's be practical. I like being practical. So how can you explain it? So that is why it's easier to just, the surrogate mother is fine, you open, carry the baby, take your baby, surrogate mother is fine, baby is fine, commissioning parents are happy. Easy. Everybody go home, give testimony.
All right. So you guys, I've heard it from Dr. Eze that it is not just what you people think, but it's done for the safety of the mother and also the safety of the baby. Looking at all the resources in terms of, because people usually think that IVF is just about material resources. They don't consider the fact the emotions, the emotional stress,
the financial
stress that comes with, going through the whole treatment process. Like you said, 50-50, it can work. Sometimes it can fail and your money goes. Because I remember when I was sitting around with someone, they're having a conversation they wanted to do gender selection. Basically, that was what they wanted. So they asked the amount, and when they were told the amount, the woman was like, how sure is this thing? They told her it's 50-50. She was like, let me just give birth to the child and use that money to train that child. So there's a whole lot of financial commitment and also the psychological commitment. And that's why medical personnel try as much as they can to give little or no room for error. And that is why they often opt for CS.
Yes.
Okay,
I know there are some people that will crucify. I know there are people in social media, the job is to comment. Commenters club. They say CS is that. Listen to me carefully. I said, if you follow through your complete antenatal, your PCV is fine. Everything is good. There's no plastic. Everything is fine. CS is like any other surgical procedure. When you do appendectomy, do you have hypertension? No, because you feel appendectomy is easy or hydrography is easy. The same percentage of complication. You understand? If everything is fine, you remove the baby and you go. If your health, your BP is normal, your sugar is fine. We are doctors. There should be little or no complications. Before those commenters will start bringing research, evidence-based, and come and put in the comment
section. For
section.
The commenters, if you're just joining, this is the Intimate Matters podcast, and you can find us on almost all the social media platforms. We're on TikTok, on Facebook, on Instagram. We're also on YouTube. You can join our personal WhatsApp channel. There you can ask your questions. Do well, to like. I'm sure by now you've subscribed and also share it. We're talking about infertility and also IVF and assisted reproductive technology, as the case may be. Okay, Ma, please can you walk us through a typical process? Because people ask things. Okay, let me start with the most common one now. People ask question about egg donation. Things like, what does it involve? Would they go and keep me and open me up and all those kind of stuff? Because you put information like this on social media, people will come. Some people will come to, as usual, to backlash you. Some people will come just being genuinely curious to know what's happening. Mm-hmm. So, okay, let's start with one of the procedure, like egg donation. People ask a lot. Because sometimes to help other people who their egg may not be sufficient to use, they may ask others to donate their egg. So the people that may be willing to donate may ask, what does it entail, egg donation?
Egg donation is a donor egg program whereby someone decides to donate their eggs for another person to use. It's a donor egg program. We call it third-party reproduction.
Okay.
That's what it's called, third-party reproduction. Now, it's a simple procedure whereby you come first, we'll do a comprehensive assessment for the donor. You understand? Some people can be particular with is there any genetic abnormality in the donor. We try as much as possible to screen, ask questions. Our questionnaire is comprehensive to screen for those. But there are some you cannot know if you don't do some genetic testing. Those ones are out of our hands. So we screen, basic infection screening. We check their follicular count to be sure they have eggs. Their age must match the age which they say. So usually in our center, donor egg program, we don't take any donor that is over 25. Why? I don't know if they've heard what we call premature ovarian failure, when some people run out of egg before 30. Okay. So we try to screen that out, you understand? So that's why our donors are at most 25. Then after preparing you're fine. Then we start the stimulation process. If we are giving you an oral contraceptive to make you bleed, because we always run our treatment in cycles, but we can do individualized treatment if the case may be.
Okay.
So you take OCP for 21 days, you bleed, we then stimulate you with hormones. The stimulation process is between 10 to 12 days. We trigger, and then we retrieve the egg. Now, the egg retrieval is a minimally invasive procedure, as I said before. We don't open you up. You lie down. We used there's a transvaginal probe that we used to do ultrasound. The same probe, we put the needle guide. The needle is very tiny, as tiny as, a broomstick. That's how tiny the needle is. You pass it through the needle guide. We pass it minimally invasively, little or no bleeding. We take the eggs from the ovaries under conscious sedation. The person is not awake because it's a painful procedure, so you sleep.
Okay.
But not deep sleep. We call it conscious sedation. After we retrieve the egg, we collect the sperm from the client or the donor sperm, as the case may be. We then mix it together, which is the IVF outside. After putting them together, either we do conventional or ICSI, whatever the case may be. Then in the next day, we check for the fertilization rate. We call it FET check. We check how many fertilized. We leave it for 5 days. Day 5, we do a blastocyst transfer. And then in 14 days, 14 excruciating days, they wait for pregnancy test. This is where the emotional stress comes in. When you tell a patient, just go and lie down in 14 days, we know if you're pregnant. So that's where, that's just the process. So in short, from start to finish, we're looking at 6 weeks.
Okay.
Plus or minus, yes.
All right. So for people who usually ask about egg donation, nobody's cutting you open. Because, like I usually say, I don't know if this is just a Nigerian thing or if this is just an African thing. Procedure that should help them, people run away from. I don't know who gave the notion that surgery is cutting open. That's how people look at it.
Yeah.
Not knowing that there are different forms of surgery. They just believe when they talk about anything surgery, you cut me and you open me up. Okay, so for IVF itself, are there people that are contraindicated for IVF and we know that this kind of person, you cannot do IVF?
Yeah, there are contraindications for IVF. Like first place is very, very advanced maternal age.
Okay.
Person cannot carry. If someone is, for our center, we stop at 50.
Okay.
So 55, 60, we don't usually advise to do IVF. We advise you to go for surrogacy. Then people with concomitant diseases, comorbidity,
okay,
rather, a non-hypertensive that is not, when you're having hypertension and diabetes together and you advance in age.
In age, okay.
Yeah, we don't advise you to do IVF. If you are battling with any form of cancer,
okay,
you understand, you cannot do IVF. Those people in the advanced world, when someone has a risk, there's a family history of cancer, what they do is that they preserve their eggs and then maybe a surrogacy, using a third-party surrogate to carry.
Okay.
So if you have any form of cancer, whether it's prostate, ovarian, breast cancer, the first thing is to save your life, to make you cancer-free. It's not for you to do IVF.
Yeah, all right.
So that chronic kidney disease, when you have kidney impairment or you are in kidney failure.
Okay.
So that's a comorbidities. IVF is, in some cases, is that like kidney failure is absolute. When you have cancer, it's absolute contraindication. Why people with diabetes, hypertension, is relative. We see it. People with severe spine issue, someone with disc problem, disc prolapse, you cannot stand out of carrying a pregnancy. It's contraindicated. So these are the few I can remember.
Okay, so basically, if you have an advanced maternal age, that's why it's
very, very advanced.
Very, very advanced.
Advanced maternal age is 35 and above. When I mean very, very advanced, I explained from 55.
When you say 35, because some people feel that 35 is like the new 20.
No. The definition of advanced maternal age in the fertility world is anybody that is 35 and above, because your egg begins to decline from 35 years old. There's a great decline when you're 40. It peaks when you're 40. There's even some research that says it starts little at your 30s, very obvious at 35. And then at 40 it peaks, because at 35, only 50% of your eggs are genetically normal and 50 are genetically abnormal. Okay. So it's 50 at 35. So that's why there's a sharp decline at age 35. So when I say advanced, I now put when you're 55 and above. Like here, we do IVF for a 50-year-old. 50-year-olds are giving birth in our center. You understand? She's 50, but she has no comorbidity. She's strong. A single thing, she carried it to term. So at that age, we usually reduce the amount of embryos we transfer. We don't transfer 2 or 1 because of the person's age. You understand? So that's it. So I say from 55 and above.
All right.
60,
55.
some centers 60, some centers 60. So depends on the center, the country, and the legal,
framework
around the country where it is. So just like IVF. Some centers, some countries, only 1 embryo you can transfer. That's a legal, framework. Why some is 3, some is 2. So depending on that. So each country varies.
All right.
But for us, from when you are above 50, we usually advise not to.
Okay, so because you talked about the legal aspect, I wanted to come there because with a greater awareness, we know more people are going to get into the space, either as people who want to utilize the service, as donors, as whatsoever. And now this brings in a lot of problem and a lot of solutions, because we are having more people wanting to donate now. We are having more people wanting to be surrogate. We are having more people wanting to use the service.
Awareness.
So what's the legality like in Nigeria as it covers the whole of fertility treatment?
Fertility, true. That's what we're still working on. It, the Association of Fertility and Reproductive Health in Nigeria. We're still working around that legality. But in our center, I can speak for our center. That's why you have questionnaires. You must sign. I tell people, if you go to a center where they don't ask you to sign any document, no matter how much they are paying you, you have to be very careful. Because if anything happens to you, there's no proof that you came there to do anything.
Okay.
There's no proof. Here you sign and we'll make sure that we've never had one case of any complication from whether it's a donor or a surrogate since inception. Why? We have legal backing. We have a document which you sign as a surrogate, as an egg donor, as even a client. Their financial policies, donor policies, policy for sperm donation. You sign all those things so you know what you're doing. You know the implication. You are aware of the complication. You are aware of the percentage, the risk involved. So you see all those things, you read through and then you do. So we try as much as possible to protect ourselves and also protect either the donor, the client, or
All right. So, like Dr. Eze had said, if you're going to a center, if you're going for any form of treatment, make sure that you put pen to paper. It's very, very essential to, guide the service you are going to receive or the service you want to provide if you are a donor, because we know that, as usual, people will always want to jump in, to take advantage. We have mushroom fertility clinics that some of them are not registered, that's sprouting up every single places. And you go on social media and you go everywhere, you see stories. They say, I should come and donate egg. They've taken 50. You see stories like that. No, because I think that was
egg retriever. How?
That was what they said. That was what they chose. This was like last year. Some children, they said they were moved from their town to another part. And they say they were sick. They don't know. These are girls. I don't think they were even up to like 19.
Wow,
so these are the kind of things that are happening. So you have your right to ask the right questions for you to actually know what is actually going to happen, so that you know if it is something that you want to do. Because some people don't even know. People will say, "Come and donate your egg." The first thing, how much? And it's unfortunate that the poverty situation in Nigeria is not helping. People will just say, "How much?" And they tell them, their mom be like, what can I do? And they count the type of iPhone the money can buy. And they don't want to know the credibility of the institution. They don't want to know who is doing this service. You can even, they say, surgeon. Anybody where some people say, good, then they cut open, they say they be surgeons. So they can, already jump on your issue. So what are the advice you can give to women? Because this is something we're seeing, that due to career or personal preference, a whole lot of women are, elongating the time they get pregnant, all right, or get into motherhood. So what are the advice you give to women like this? So if a lady comes in, a young lady, maybe in her early 20s, and I'm like, see, I have like a 10-year, 15, 20-year career plan in front of me. I feel that having a child, or as the case may be, may distract what I want to do. What kind of advice do you have for such a person?
What I would advise the person is to, first, she has to freeze her eggs. That's the first thing. So if you have a 15, 20-year career path, you're in your early 20s or even late 20s, 15, 20 years, you'll be like in your 40s or late 30s. And at that time, there's already sharp decline in your egg. So the first thing is to freeze your egg. You should know that it's a financial implication. It's not cheap. You understand? So, and you might do 1 or 2 cycles for us to get at least 15 to 20 eggs to keep for you. And the quality of the egg depends on the age in which you give us. So if you give us the egg when you're quite young, the quality is going to be good. If you wait to give us the egg when you're 35, that's the quality of the egg. That would be the quality of the egg, even when we thaw it. So the younger, the better. And you also should know that not every egg can survive. We call it thawing. Thawing is a process of dissolving the egg to use it in future.
Okay, after it has been preserved.
After we have preserved, yes, we thaw.
Okay.
So it's that process. So not all the eggs will survive it. That's why we say the more the merrier.
Okay.
That's why I'm saying you can do maybe 1 or 2 cycles for us to get 15 to 20, even 30, if possible 40. We freeze it for you. So when you want to use it, we thaw, and put in mind that it's one of the process that can help you achieve pregnancy in future. But unfortunately, there's no guarantee.
Okay.
It's not 100%. I always put that in front. It's not 100%. So you might have to do multiple treatment to achieve pregnancy. The beauty about it is that you might have multiple. And then if you're someone who wants 2 or 3, but if you're someone that you want 7 or 10, and you want to do career first, I think you have to sit down and rethink again. Okay. So the quantity of children you want in future depends on, you understand what I'm being realistic.
Yeah, it's still very personal to me, because I was looking like 11 to 12, like fielding a football field. But now I still have a career I want to pursue. Okay,
11
because
to 12.
We're hearing a whole lot of this
in this economy.
God will provide.
It is well.
But we're looking at these things mostly like women. Are there no assisted reproductive technology for men? Is it that when our own don't go, you don't go?
No, the beauty in men is that the motility begins to decline at a later age, when they are 50-something. A man can produce sperm all his life, as far as you don't have a condition whereby you don't have a sperm or you have a low sperm count. There are conditions. Now, young people are coming down with no sperm, azoospermia, oligospermia, different spermias. You understand? So, but if you're good, your fertility begins to decline at 50-something. The only risk for men is that as you advance, there's high risk of having chromosomal problems, abnormality. Just like the woman, the only problem with the woman is that she runs out of eggs earlier. So a woman can be 45 and there's no egg. She cannot use, even at 40, 42. The chance of using your egg is 5%. It's very slim. So it's a very slim percentage you are working with. But for men, you can still see sperm, you can still use your sperm, you understand? But for women, they run out of egg. With 45, 50, a woman cannot use egg. So that's why she needs to freeze. But for a man, you can freeze if, let me give an example. I have a client that came from the US, US now. Now, he's the only son from his father. And he according to me, that's why when you are brought up, they are very aware. The mother said giving birth to him was a miracle because the man has sperm problem. He also had the problem. You understand? So what he's even telling me now is that when the son is of age, they will freeze the son's sperm because the son is at risk of having the same genetic. He has no varicose, he has no issue, but he has a bad sperm. So the wife is telling me that they are planning to freeze the son's sperm when he's 20-something. There are people who are aware. Because tracing back, there's a genetic. That's why you need to be aware of your family history. So when you come, I ask you, how many children do you have? Is there anybody having had any challenge, your uncles giving birth? Those histories are very important to help us, especially when your result comes and your sperm is somehow, we try to see there's no risk factor, but we try to trace the family history if there's any genetic problem making the sperm bad. So men can freeze their sperm. You can even freeze the sperm for longer. It stays the way it is. But as you advance in age, motility gets slow. But you can produce sperm all through your life. So you're not like in the category of the women that runs out of egg. I hope I was able to explain.
Yeah, so because I have a plan for a career. So I'm also thinking of if I should actually freeze my egg for what
sperm.
Freeze Freeze my sperm, not egg.
It's possible.
Freeze my sperm, not egg. Okay, because you mentioned something, and that should be a pointer to men out there, because oftentimes when there is an issue of infertility, it's always women. Some men will never agree that in this life that they had a problem. So you should look around you, right? Fertility issue runs in family. Did your father struggle? Did your uncle struggle? Maybe there could be a problem that may need you, to check yourself and also to get your sperm frozen so that you can use it later.
Do you know how many percentage male factor and female factor is the same 40%? So male factor is 40%, female is 40%. So even if you come to a center, women do that a lot. You see a woman coming, she'll say she's the problem. Your husband is fine. I say, how did you know your husband is fine? He said, he's fine because he has children. I said, that is not an indication that his sperm is fine because he has children.
Might not even be
That's
children.
how many years ago? He said, one is 16, the other one is 18. Is that an indication?
Secondary.
So I say, please, it's secondary, good. Just like a woman can give birth and have challenge giving birth. Secondary. So there's primary and there's secondary. You understand? So I used to say, come together. Let us check. And most cases, we pick either bad motility, very low motility, or low sperm count. Most cases. And then the man will start arguing. But SSI 20 years ago. Anything can happen to your sperm in 20 years. It's 16 years ago. Anything. Even 6 months. We repeat semen analysis after 6 months, not talk of 16 years.
All right. So men out there, support your women. Come out and also get yourself tested.
Exactly.
Women also don't always think that you're always the problem. For the men, you may have had a child 20 years ago. Things would have changed. Somehow, are you even sure it was your child?
I know they will.
Might not even be your child, but you're claiming. Okay, man. So let's just, as we're trying to run off, let's look at the issue with lifestyle. Does the lifestyle somebody put up first affect your fertility, male and female? And on the flip side, does it also affect the success of IVF? Does it mean that there is a lifestyle I can put up, maybe if I or my woman were going through the treatment, that will affect the success of the process?
Yeah. Lifestyle modification is a big factor. I always use myself as an example. I got married after I was 35, and I got my son. My son is 1 year plus. I didn't take one supplement. I didn't do any stimulation. Why? I'm a fan of lifestyle modification. I'm that fan. So what you take in your body can either destroy you or make you. Now, the issue of infertility in the young, if you look closely, we have a problem with lifestyle factors. Now, smoking has become a norm. There's nothing that destroys the egg and sperm as cigarette.
Cigarettes, grass, ganja,
anything.
Vape, shisha.
I had a surrogate mother that asked her, do you smoke tobacco? She said no, but she smoked weed. So these days, when I consult, I tell you, do you smoke tobacco? You say no. I ask you, do you smoke weed? Do you take shisha? I will ask all of them because it took me, I wasn't expecting the answer. So I was already documenting.
No.
Tobacco, no. She said, but I smoke weed. I paused. So these days I ask everything.
Okay.
So sperm is so fragile. The eggs are so fragile. So any small change, all these are proteins. The sperm and sperm, they are made of protein. So protein can be denatured like this. So smoking is one factor that can destroy anything in your body. It is so sperm like water. So smoking is a no-no. So when I consult, I don't tell you stop, reduce smoking. I tell you stop smoking. I can tell you reduce the quantity of alcohol, but I cannot tell you reduce smoking. Smoking, you have to find a way to stop it. I'll give you a typical case scenario. A man that presented. Now, I always give this case scenario so people know the hamper, the challenge in which smoking posed. So this man, we did the specimen analysis. It was fine. Motility was okay, sperm count was okay, but this man is a chain smoker and a chain drinker. We keep stimulating the wife and triggering. No result. She keep not getting pregnant. And it's not in our nature. Usually 6 months to 1 year, you should get pregnant. God has helped us like that. So we keep begging this man. He will tell us, nothing is wrong with my sperm. He will smoke. Till today, I'm telling you, the wife just called me. She's leaving because she's tired. So this man keeps smoking and keep drinking because he feels, and I cannot lie to somebody because I want to. The wife said, lie to him. I said, I cannot do that. Your husband is an adult. I cannot falsify results. Because if you start that, tomorrow she'll go and bring her friend. Or tomorrow say, don't go there because they used to falsify results. I said, I will tell him his result is fine. But there's something the smoking is doing to the DNA of the sperm that we are not seeing. And it's affecting their chances. So smoking is a risk factor. So smoking is stop. Whatever you're smoking, stop it. You understand? 2, alcohol. If you're drinking 3 bottles in a sitting, please reduce it to 1 bottle in a day, in a month, if you're trying to conceive. After conception, you can go back to whatever you are doing. You understand? Alcohol. But when you're in the process of IVF, drastically reduce drinking. Processed food, shawarma has become a normal thing. Meat pie, donuts. Anybody that is hungry now, do the math. Check anyone, say, I'm very thirsty. Check what they buy.
Carbonated drinks.
Exactly. Nobody buys water. Nobody buys water. One day, when I was the cancer screening coordinator I did that research. So I made sure that we had water, we had drink. So any client that comes for cancer screening, Maud, what do you want? As do you have Coke? I'm very thirsty, please give me Coke. I'm very thirsty, give me malt. You understand? I'm very hungry, do you have meat pie? Do you have buns? Nobody say, I'm very hungry, give me that banana or give me that apple. You understand? Because that is what we are used to. So if you can watch what you take in your body, you take a shorter time to achieve conception in most cases. That's the truth.
All right. So especially for the young guys and the young ladies, this one may not really be palatable. Smoking, cut it off. Drinking, reduce it. Then, drastically. Then.
And if you're a woman trying to conceive, please drink, stop. Because there's no safe alcohol intake. So you can take a sip of alcohol and miscarry that baby. You can take a gallon of alcohol and miscarry that baby. So there's no safe alcohol intake. For men, you drastically reduce. In short, stop all of them. Because when you say reduce, someone will say, I used to drink 1 carton. I've reduced to 10. So it's reduction.
Yeah, so a carton of 12, I've reduced to 10. I've dropped 2 bottles. It's essential. And also, I know this one, the ladies may not really like it. Shawarma. Shawarma is
processed food.
Processed food, especially good. Shawarma. It's not a proof of love, right? So shawarma is not a proof of love. Okay, ma. So when it comes to the fertility space in Nigeria, I know things usually change. How has it evolved, and what are possible future prediction, the way you look in how it's going to be in the country?
I feel that we are progressing very good, because now a man with a sperm count of 1 million, we can do ICSI, to take that, look for that 1 sperm and inseminate that 1 egg. So there's progress in the fertility space. Even people with azoospermia, we can do procedures such as PESA, percutaneous sperm extraction or aspiration, to look for that sperm. We might not be seeing it in the ejaculate, but we can do a minimal invasive procedure that we express the semen directly, or open and cut and then give it to the embryologist. So there are advanced techniques coming up. And now we can do, people who have AS, we can do genotype selection. We can do sex selection. You understand? The process are called PGT, pre-implantation genetic testing.
Okay.
But abroad, they use the PGT to rule out chromosomal abnormalities. Also, we use it to select sex in Africa.
Yeah, because we love boy children.
We love boy children, you see. So you can people do it, but it's not routine abroad. They usually use it to check, we have a chromosomal problem in my family, so we want to check the embryo, see if they are fine. But here we need to check it. This not boy, this not girl. Give me boy, leave girl. You understand? Nigeria, we are wonderful.
Okay.
So there's PGT. You can do it to check genotype selection. So these are the advances in ART. It's moved from conventional to ICSI, to PESA, and then to PGT.
All right. So whether you're looking for a way to stimulate your ovary or you're looking for a way to, do some selection as it pertains to, the genetics, whether it's the genotype or whether it's the gender.
To preserve fertility.
Or to preserve fertility. That is why we have assisted
eggs.
reproductive technology. A very important one, the ethical issues. Because sometimes you sit around, especially when you talk to people and people paint scenarios. Things like, especially in the African climate, how much we are into committed relationships and marriages, and maybe single people. When I say people who are not in a committed relationship, coming up with children, maybe due to using donor egg or donor sperm or, surrogate as the case may be. What are possible ethical issues that we're having with this? And you also talked about some countries wanting you to, maybe only take one embryo. Some people will take multiple. So what happens? What are all these ethical issues with the embryo developing and maybe using one and not using the other?
Okay, if I understand you correctly, there are some, wherever country you find yourself, you follow their guidelines.
Okay.
I'll establish that. There are guidelines in different countries. So you follow the guidelines. Whether you're practicing there or you're going for IVF there, you follow the guidelines. Now, regarding using donor egg and donor sperm. Now, when you're coming as a couple, I advise that you discuss with your partners. Are there scenarios whereby the woman wants to use a donor and doesn't want the husband to know? Yes. Are there scenarios whereby the man wants to use a donor and doesn't want the wife to know? Yes. But my job is you sign the consent, and I treat clients individually, and I tell you, go and discuss with your spouse. Whether you discuss or not is not my problem, but I ensure go and discuss with your spouse. There are cases where some single ladies, they advance in age, they don't have a partner, they want a child, they come and they get. You understand? So what we try to do is to make sure that the treatment is, is holistic.
Okay.
Husband and wife, they are aware of what they are doing. But in some cases, you can try your best and still. A typical example, I saw a review of a result. So the man came with the wife. I don't know who, in fact, it's a man I want to review to, but the wife instead to follow. I told her to go out because I'm reviewing the husband's result. I said, whatever it is, your husband will tell you. Just for me to finish reviewing the result, the husband went to tell the wife a different thing. The wife came in. I said, my husband says it's very low. What are we going to do? Me, I was shocked because that's not what I told him. There was nothing. We didn't see anything. I said, do what I asked him to do and you'll be fine.
Okay.
So the man was looking at me, do what I asked. So sometimes you have to use wisdom because they can decide to be fighting in your consulting room. Yes, there's a case whereby we had to it was a big scandal. That's why we started seeing people individually. That case was HIV result. The woman came, the husband was not around. We reviewed that result. So when the woman, that's the center I was working before. So the man came and said, my wife, I don't hide anything from my wife. Tell her my result. I said, sir. She came, I said, I need a verbal or written consent. So the man called. So we called with the office line. The husband picked. The wife said, yes, I consent that my result be communicated to my wife. As we did that, Jesus, the wife paused. The man had to come. We didn't know what happened. The man wasn't around. The next day, very early, we see husband and wife. The man said he has not slept. He slept in the corridor. That the wife brought testing strips. He was pricking the husband to test. And all of them said the test he did was negative. That where did we get our own? We had to repeat it again. HIV was positive. I said, okay, to confirm that, go to the teaching hospital. They will do a confirmatory test. Because we cannot give you your own result. You said it's negative, but our own is showing positive. Go and do a confirmatory test. And that was the end. What am I trying to say? There was a big fight. So no matter how you try to tell me that you and your wife, you will eat from the same plate, you are one, I do individualistic treatment, and you go and discuss. There are some that will sit down and say they are not going, see us together. And I ask you questions, so you cannot lie. And I'll tell you, I'm going to ask you everything. How many abortions you have done? I go deep. How many sexual? I go deep to get my results. So sometimes when I will ask questions, so you people should know. You people should go and discuss. So to get the right result. So sometimes it helps those people who are together. It makes the treatment easy. those people who are different, you have to be wise. It makes the treatment very difficult and cumbersome. So we try to move around it. That's the short answer to.
All right. So when you go there, please say the truth. And if you insist that it must be with your partner, they will ask deep questions. They will ask you questions about body count.
Our own center, but body count.
Because people run.
I will ask about, it helps. No, I tell people, if you lie and say you've never had any miscarriage, you've never had this, you're telling me you're having primary fertility. It's more difficult to treat than secondary. So I say the truth is better. It shows that you can even carry pregnancy. When you say you've not carried pregnancy because your partner is there, you're giving us a wrong diagnosis, and our treatment will now be more, we have to do this test to be sure what's the issue. But when you say you've had abortions before and you did, you say, okay, this woman has been able to conceive, being pregnant, so there's something deep. So your partner has to do tests. So it makes it holistic. But when you come and keep lying, and then we don't know how to, you're making your treatment more difficult. So the truth is that you come as a couple. If you want help in your infertility, if you want help, come as a couple. Say the truth, and there's nobody that is at fault, because what happened to your partner, it could easily be you.
Sure,
it could easily be you. This woman is the one that has blocked tube today. Tomorrow it might be you that don't have any sperm. It can easily switch. So nobody is the cause. You come here together for a solution. That's why you are here. Okay. Not to pass blame and say, I told you are the cause. And I warn women. I say when you come, most of these men hide because people will not give them peace. I told you are the cause. I told you this drink you're drinking. I told you this. In my presence, you already complain. I said, that's why the man will hide it. You already complain. This thing you're drinking is causing. Now the sperm has gone low. I say, madam, calm down. That is why he will keep hiding the result from you. You're here to profit. So you are very big. So if we even start treatment, who knows whether you will even respond to FSH? That's why I told her that she kept quiet. I said, it's not only one person. We're not coming here to pass blame. We're coming here to provide solution. So let's work together.
All right. So if you have your individual differences, keep it at home. If your mother and father had say you should not marry me, it's not in the fertility consulting room. You need to say, okay, Mama, thank you so much for coming. Thank you so much for sharing from your wealth of knowledge. You've been talking about your center, please. I know Renewed Medical and Fertility Clinic. So what do you do there, and how can we get to?
Okay, Renewed Medical and Fertility Clinic is a minimal invasive access center. There we do from comprehensive fertility assessment to ovarian stimulation with time sexual intercourse, to superovulation, to IUI, intrauterine insemination, to IVF, to ICSI. This procedure has been turned into PGT, pre-implantation genetic testing, where we do genotype and sex selection. So we do a whole lot there. So we're located at number 13 Enoidem Street off Nepal Line, Uyo, in Akwa Ibom State.
All right, so 13 Enoidem Street off Nepal Line, off Abak Road.
You can come from Abak, you can come from Accra Road.
All right, so if you're looking for any of the services that have been listed, that is where to go and meet with Dr. Chinoya Eze. Thank you so much, Ma, for coming. And for our viewers out there, I hope that you really learned a lot today. Today, we're talking about infertility and also relating it to assisted reproductive technology, IVF precisely. And we believe that there are so many issues that could lead to infertility, but it doesn't mean that you need to lose hope. Science came so that you may have salvation. God gave humans this knowledge so that they can help. Assisted, emphasis assisted. There's no manufacturing, just helping you to overcome the barriers. If you have any questions, do well. Put it on the comment section. Do well to like and share this video. Share it to your church WhatsApp group. Share it to your family WhatsApp group. In fact, you can even share it to your village WhatsApp group. We'll be so happy to have you share there. And follow us on all our social media platforms, on Facebook, Instagram, on TikTok, and also join our WhatsApp channel. And there we'll be glad to interact with you. Thank you so much for joining this episode. And you know that I am your pilot on this drive. My name is Nosakwa Okpan. And until I see you next time, goodbye for now.